We start this week by looking at the National Health Service, the current state of it. We also heard a bit about it in part one in Prime Minister's Questions, but I'm joined now by Mike Campbell. Mike's from Protect Our NHS here in Bristol. Hi Mike, welcome to the Politics Show.
Evening, Tony.
Can you tell us a little bit about Protect Our NHS? What's the aim? I suppose a bit of education, but how are you going to actually change anything?
Well, we were formed about 2 years ago in Bristol. Our major concerns about NHS privatisation, the impact of privatisation, and some of the concerns we have about political vested interests. Those people, specifically politicians, who have a vested interest in voting for privatisation of the NHS. And to some extent, the debate continues the story that you were having, the narrative you had earlier about privatisation of water. And indeed, I'd just like to mention privatisation of the railways. In the last year of the major government, there was a massive move to move railways out of the public sector.
So we're talking about, sorry to interrupt you, but we're talking about mid-1990s.
This was mid-90s. And what you have now within the railway service, railway network, is a number of different companies running our railway services. And we're spending, through our subsidies, through our taxes, more money now than we were spending at the end of a nationalised service. If you take privatisation of energy, of gas and electricity, we're spending nearly 50% more on energy bills, whereas at the same time, cost of purchasing energy has dropped by 5%. And I think the argument behind...
You mean a sort of bulk purchase, a wholesale price?
Yes.
Yeah.
So, and the argument I think that Protect Our NHS is making is that there's this belief that somehow selling off the NHS or selling off parts of the health service is going to be a cheaper, more efficient way of running our health service. And all the evidence is, leaving aside whether we want an NHS in private hands with people making profit, leaving that aside, it's whether or not we feel that, or people, taxpayers believe that it's better to have a privatised service rather than a public service. And I think that's the debate we're having. And it started with water, gas, electricity, railways, and other nationalised services. So the debate, Tony, is: do we want an NHS which is publicly accountable, public available, and in the hands of the taxpayer, i.e. you and me, people who pay for the NHS through our taxes?
Okay, so there's been the Health and Social Care Act,
yep.
With Jeremy Hunt now. He's in charge there. But look, what has it actually meant? How's the health service changed? Because for a lot of people, maybe surgeries are a bit more crowded. It's more difficult, possibly. Yeah. Well, it is more difficult to get doctor's appointments. But how's it actually changed? What's happened behind the scenes?
Essentially, what's happened since the Health and Social Care Act, and to be absolutely fair, privatisation had started before the coalition government had come into power. What we have seen is an absolute growing rate of privatisation, which has resulted in billions of pounds of money going out from the NHS, going into private companies. Now, at the moment, most people who go and see their GP or go into hospital will go thinking and knowing that it's free at the point where they go into hospital. What we're going to see is the more that we have private companies running the NHS, the more there will be an impetus, a push to start charging. And to give you one example, already Charlotte Leslie, our MP in North West Bristol, believes we should be charging for people to go and see their GP. Already there are numerous ways we're being expected to pay through top-up for hospital beds and services. So what we're saying is that, yes, it's only 2 years since the Health and Social Care Act came into being, but when you said it earlier, when you've got arms companies who are interested in running parts of the NHS, you've got Richard Branson, who is bidding to take on one of the biggest cancer services in the Midlands, which is going to be worth over £800 million. We have to start asking questions about what kind of health service we want.
Well, there's a bit of news recently in Bristol, actually, just about a week ago. 1/3 of GP surgeries in Bristol Northwest, that's Charlotte Leslie's constituency, are causing concern to the GP's regulator. The Care Quality Commission said they're causing concern. The recent assessment of GP services across the country. Falladon Way Medical Centre in Henleaze received the lowest rating, being of the highest concern, whilst Helloir, I think that's pronounced, I'm not sure, Medical Centre in Stoke Bishop was flagged as causing some concern too. Also, Ridingleys Medical Centre in Lawrence Weston and Sea Mills Surgery. The Bristol Labour Party recently undertook a survey of GP practices in the city following the closure of St Martin's Surgery in South Bristol in the summer. A report led by Kerry McCarthy, MP, and concluded that many GPs and practice managers were concerned about their ability to actually meet patient demand in the future.
If you waste, and I'm going to call it waste, up to £3 billion on reforming the NHS, which is, and the government used the word reform, I'll use the word waste. If you're going to make real price cuts in the service, and I'm not saying that the level of funding for the NHS has dropped in real terms. If you have a permanent kind of state of criticism of the NHS and of GPs as well, then inevitably you're going to have a diminution of service, a reduction in the kind of service that's being offered. A number of us within Protector NHS have been visiting GP practices and talking to GPs. And I don't know whether you've had a GP in here, Tony, talking about the pressure on their service at the moment. But they are under enormous pressure to deliver more and more with less and less. That is what GPs are saying. GPs are working. I met a GP the other day who's working a 12-hour day. And we have another problem, which is recruitment of GPs. We have a demographic time bomb in terms of the numbers of GPs who are in training and the numbers of GPs who want doctors who want to go into general practice. So clearly there is a problem within GP practices. Not all, but there will be some, and certainly those in some areas of Bristol where they serve sort of more vulnerable populations with higher need. We are going to be facing a crisis within the next year or two.
Old Labour Oxford economist Martin Summers, let me bring you in here. You say that these changes are ideological. What exactly do you mean by that? What's the ideology behind it?
Well, in the most basic level, David Cameron, before the last election, said, one of the few promises that he actually made, there will be no top-down reorganisation of the National Health Service. Now, when he made that statement, he must have known that he was lying, because we now know that the decisions to go for the policy that they've gone for were being discussed behind the scenes when he made that statement. And I think that alone should lose him the next election. And that's all I'll say on that point. The fact is, the NHS. There was a study done recently by, I've forgotten the name of the trust in the US. It's a very important, widely recognised think tank, as it were. And they said that the British NHS was by far the cheapest system in the world. It wasn't the best because we don't spend as much on healthcare as other people do, but in terms of bang for the buck, it was the best. And that's because a centrally planned system is in fact more efficient than a market-led system. And this is what the New Labour didn't really get their heads around. The idea is, we've got a very good centrally planned NHS, but if we just bring in a bit of market, that will just make it a little bit better. That's simply wrong-headed. It's an efficient system because it's a planned system. And once you start messing with that, it's not a planned system anymore, and it starts to be less efficient.
Isn't one of the reasons why people are living longer today than ever before? Isn't it because we've had the health service since the Second World War?
Well, indeed, and therefore, and there's a very old conservative slogan which I agree with, which is, if it ain't broke, don't fix it. the idea that the NHS is fundamentally flawed. I mean, the far right of the Tory party are absolutely clear. They see it as a huge behemoth inherited from the past, a part of the 1950s Britain they want to escape from, apart from when it comes to things like social behaviour. But in actual fact, the NHS is still the most efficient system because, for example, being a monopsony buyer of drugs means that they can force down the price that they get when they go to the drug companies. And don't forget, a lot of the expense of the NHS is in fact the extortionate prices that drug companies demand for their drugs. And you know what the solution to that is? Nationalise the drug companies, not more competition. And I think we've not made this case for a generation properly. Competition has its place when we're selling soap powder, but when we're talking about people's health, in fact, competition is a pernicious philosophy.
Can I add, Tony? Martin's absolutely right. And the thing about competition, it's wasteful.
Yes.
It doesn't actually save money. And if we just take one example of a tendering process to provide a contract to supply older people services in Cambridgeshire, £1 million was spent on that. And it ended up going back to the NHS. And it does strike me as being ideologically, and I think Martin is absolutely right, it's an ideologically driven policy. And let's just take that ideology for one moment. Oliver Letwin, who is a key strategic player within the cabinet, said to a private audience a number of years ago that within 5 years of the next Tory government, the NHS would disappear as we know it. And my fear is that that promise, that prediction is coming true. And the second thing I want to say about politics is it right that members of Parliament who have vested interests ranging from care companies that provide health services, vested interests in pharmaceutical companies, vested interests in other providers of healthcare technology, is it right that they can vote in favour of an act which basically puts and encourages the health service to be put out to competition, where the companies that they are linked with can then bid and win? It feels, I mean, for me and for many of us, we feel that is a basically immoral way to run a health service. And I just want to mention Care UK, because you may have seen a recent article that's been produced in Bristol, that Care UK, through the last Labour government, I have to say, were given a block contract of over £6 million a year to provide smaller elective surgeries up at Emerson's Green. They have underspent their block contract to the tune of £7.3 million over the last 3 years. That money has been lost to Care UK. That's not coming back to us. The NHS is not going to have that money back. If it had gone to an NHS provider, any underspend would have come back to the taxpayer. Protector NHS, we wrote to the chief executive last year saying, look, could you please repay Bristol NHS that money? We didn't have a reply. I know, not surprised we didn't have a reply. But I think those are the kind of big questions that we have to be asking and debate. And when it comes to the next election, we have to be challenging and calling to account our politicians for the way they're treating the NHS.
You mentioning Oliver Letwin, doing a little search for him on the internet. This is back in June 2004. Oliver Letwin told a private meeting the NHS will not exist within 5 years of a Conservative election victory.
You found it, Tony, while I was
2004. That's 10 years ago.
Exactly.
So when David Cameron says, read my lips, there will be no top-down reorganisation of the National Health Service.
It sounds like Oliver Letwin's running the Conservative Party, not David Cameron. Tell us a bit more about this Oliver Letwin character. He sounds to me like...
Well, he was a shadow... Martin probably may correct me if I'm wrong. He was Shadow Chancellor at one point. He played a key strategic role within the Thatcher government.
He's Chancellor of the Duchy of Lancaster.
He wrote a book,
which is,
I think, called Privatising the World, and it was really a guide. It was a guidance to corporates about what are the strategies that you implement to privatise public services, and three of them are happening at the moment. What you do is you reduce levels of funding for public service. Secondly, and what results of that is services go down, services get worse. You then criticise those public services using mainstream media. And we've got a lot of criticisms of the BBC, the way it's never and hasn't challenged the current government over the NHS privatisation issue. And then fourthly, what you say is, well, public services don't work, let's put it out to private services. And that's exactly where Oliver Letwin comes from in terms of his ideology.
Yeah, so he's now Chancellor of the Duchy of Lancaster, whose role apparently occupies an average of 1 day a week. He's also a minister as well.
I think his 1 day a role a week is probably less important than the influence he has on overall Tory coalition
But
policy.
this is one of the Queen's estates, the Duchy of Lancaster, isn't it? I'm just interested in who this chappie is who seems to be actually running things, because David Cameron seems to be a kind of spokesperson for various industries, where this guy is actually making the policy, not him.
Yes.
Can I just make a further point? Once the idea that if you, for example, you'll get coalition MPs on here saying, well, it'll still be free at the point of delivery. Now, what point I would make to that, because they don't seem to understand, is that once you open any industry up to competitive pressure, you are then under EU law, and if we signed the trade and investment partnership with the US, under international law, obliged to take the lowest bid for any contract that's put in. So what will happen if you open up, the GP funding bodies will decide that they're going to open this up and they're going to get different contractors in, that if you don't give it to the lowest contractor, they will sue you. And what these big US companies like Lockheed Martin will do is they will make sure that their bids are the lowest at stage one. And if you don't take their bid, they will sue you. And then you will lose all control over who you have providing the services, because they will then decide. And of course, what they eventually do is when they've captured the situation, like with First Bus, you then raise the prices once you're in there. And of course, it's a way of doing things by stealth. You just outlined the political strategy behind all of this, to do it by stealth, which is why when David Cameron says he's not going to have a top-down reorganisation of the National Health Service, that is a scandal, because he was planning a top-down reorganisation, and for that alone, he should lose his job.
Okay, before we go on to have a look at this amazing news about Lockheed Martin in the frame for a £1 billion NHS contract, let's go back to Prime Minister's questions on Wednesday, where Andy Slaughter MP was bringing up some points for the Prime Minister to answer about accident and emergency services in the west of London, which are having all sorts of problems.
Andy Slaughter.
Thank you, Mr. Speaker. Following the closure of Hammersmith and Central Middlesex A&E departments in September, West London now has some of the worst waiting times for A&E in the country. But last week, NHS England told the Evening Standard that Charing Cross A&E would be replaced with an emergency centre run by GPs and nurses. Will the Prime Minister abandon any further cuts to A&E services in West London?
But what the honourable gentleman should know is not only are we recruiting more A&E consultants and nurses in North West London, not only are Northwick Park and Ealing Hospital getting more beds, but both Hammersmith and Central Middlesex hospitals have GP-led urgent care centres on site that are open 24 hours a day, 7 days a week. So instead of trying to frighten his constituents, he should be talking about the investment going into the local health service.
Well, listening to that, one would think that there was no sort of crisis with accident and emergency. But I'm joined by Mike Campbell from Protect Our NHS. What is going on in accident and emergency? Because it does seem that because of various other parts of the National Health Service are in crisis, people can't get doctor's appointments, this kind of thing, that everybody seems to be turning up at accident and emergency, and they simply can't cope. We've had several accident and emergency centres that have had to completely close down because they're overwhelmed.
Well, the irony of this week was Jeremy Hunt being questioned by Andy Burnham about why he took a member of his family to an A&E department when he could have easily taken him and referred him to a GP out of hours service. And I think we've got here a fundamental problem, which is if you close ambulance stations, if you then double spending on private ambulances as a result of that, if you downgrade or close up to 16% of your A&E hospital units, if you have less hospital beds, which we have at the moment, that's all going to be putting pressure on A&E and waiting times to get into an A&E. And actually, when David Cameron talks about the increases, he's not telling the truth. If people looked at the facts, in fact, there are over 8,000 fewer specialist nurses now We've got situations, a scandalous situation where we have up to 60% of nursing posts unfilled, and the NHS Trust having to buy in through agencies at often double the cost, agency staff in to cover those posts. So you have here a kind of, it's rather like the perfect storm, isn't it? That if you have all those factors coming together, then clearly you're going to have especially units, A&E units where there is a high need, failing to meet their targets. In Bristol, and I don't have the figures with me, but the clinical commissioning group in Bristol has to report every month, and does report, on A&E waiting times, and it will be very interesting to see what Bristol's for, because they have to be seen within 4 hours. This is the kind of target we're talking about. It'll be interesting to see what the Bristol situation is.
Well, the National Health Service came up at Prime Minister's Questions now. So, Mike, if you don't mind, I'm going to have a listen to that and ask you to respond afterwards as what you think of the question and the answer and the subject matter they're looking at. So let's go back to Wednesday now with the Leader of the Opposition, Ed Miliband, asking questions of the Prime Minister, David Cameron, all about the NHS.
We saw a report this week of a patient waiting 35 hours in A&E. And across England, A&Es including Scunthorpe, Middlesbrough and Kings Lynn are telling patients not to turn up. And we've seen report after report of patients waiting hours for ambulances. Does this represent more than some isolated incidents, but actually shows an NHS in England at breaking point?
What the figures show is, yes, the NHS is under pressure, and the figures are these. Last week, 429,000 people presented at accident and emergency units across England. That is 3,000 more patients every day than under the last government. So that's what's happened, is a big increase in accident and emergency admissions. Now, the target, as he knows, is to see 95% within 4 hours. The running total for this year is 94.7%, so 0.3% below what we are meant to achieve. Now, the key thing is, what are we going to do to respond to these problems in A&E? What we are doing is putting £700 million more into the NHS this year. Now, we're only able to do that because we have a strong and growing economy, and that is the key. You can only have a strong NHS if you have a strong economy.
Speaker, the truth is that the crisis in A&E is a symptom of the crisis in elderly care and in relation to getting to see a GP. Now it's the case that one of the biggest problems is that 1 in 4 people are unable to get to see a GP within a week. And we even heard yesterday from the Health Secretary that this is a problem. Mr. Speaker, what does it say about the NHS when the Health Secretary says he goes to A&E because he can't get a GP appointment?
Yet again, he comes to this House and raises a problem that he created. Yes, it was the Labour Party's GP's contract. After that happened, 90% of doctors opted out of out-of-hours care. That is why we are putting in place arrangements for 7-day opening for GPs. Already 7 million people have access to that. But I repeat, if you can't run the economy, you can't run the NHS, and he couldn't run either.
Well, people, Tony, people are waiting in A&E for over 4 hours, and that rate is at a 10-year high. When David Cameron talks about this as a problem caused by the Labour government and the GP contract, I think there are people who question that GP contract, but the issue there isn't the contract per se, it's the way that out-of-hours service have since been organised, and that is partly to do with the competition problems we've got. Out-of-hours service at the moment in Bristol are run by a private company. They had real problems last year over this. If you've got people who don't feel confident about ringing their GP or an out-of-hours service out of hours, then you're going to get more people going to A&E. So, it's the overall pressure being put on the health service that is creating this problem. The other thing is targets. David Cameron talks about this slightly 0.34% reduce under the 95%. I think there are more fundamental issues here rather than having to meet targets. It's about how much money we're going to put into the NHS, how much money are taxpayers prepared to pay to have a health service that delivers. And the one thing the Labour government did do is it did put a lot more money. Martin said that they opened the door to competition and marketisation. It's right, but they actually did invest a lot more money in the NHS after it had been driven to quite low depths in a previous Tory government.
Just hang on a second, Mark. We're going to go back to the Commons and just get another snatch from that little chit-chat between the Leader of the Opposition, because this is clearly building up to be quite a big issue at next year's general election. So let's just listen to the conclusion of that discussion there.
The truth is, we introduced evening and weekend opening. He cut it. We opened walk-in centres. He shut them. And he promised to improve GP access, and he hasn't delivered it. And it's happening on his watch. And today, Mr. Speaker, the King's Fund says that without an emergency injection of resources, the NHS is going to face financial meltdown. This is exactly the same pattern that we saw under the last Tory government. Winter crisis followed by emergency bailouts. Isn't it a damning indictment of his record on the NHS that we are back to those days?
What we have with the NHS is this government putting £12.7 billion more into the NHS. That's why we've got 1,200 more nurses, 8,000 more doctors, and patients are being treated with greater care. But the real point is this. He famously forgot to mention the deficit. And we know what happens when you forget about the deficit. Look what happened to healthcare spending in Portugal, cut by 17%. Look what happened to healthcare spending in Greece, cut by 14%. He can't run the economy, he can't run the NHS, he's got no plan for either.
I'll tell him what's happening. Deficits are rising right across the NHS because of his mismanagement, his top-down reorganisation that nobody wanted and nobody voted for. And he's turned the NHS from a service that was succeeding to a service in crisis. And it is a crisis of his making. He closed the walk-in centres. He introduced the top-down reorganisation. He cancelled the GP target so people could get in to see their general practitioner. He's broken his promises. Only a Labour government can save the National Health Service.
What he forgets is when we put £12.7 billion into the NHS, his shadow health secretary said it was irresponsible. It's only because we've safeguarded the economy that we can safeguard the NHS. The fact is, he forgets the deficit, his shadow health secretary forgets mid-staffs, and both of them have forgotten you only get a strong health service with a strong economy.
Just 2 points there, Tony. One, if we bring it back to Bristol, Bristol had an NHS walk-in centre in the centre. That is one of 72 walk-in centres that have closed across the country. That's bound to have an impact upon pressure on GPs on A&E. Secondly, I would really think we should question the claims of this 16 billion that Cameron talks about going into the NHS. What's interesting is the cost of contracts to private health companies has been over 16 billion since the Tories came into power. So I suspect that a lot of that money, it may be coming to the NHS, but it's going straight out to people to make a profit.
Also, we've got two big trusts here in Bristol. We've got the North Bristol NHS Trust at Southmead and what was Finchay, and other sites, and also the United Hospitals Bristol NHS Trust in the centre, to combine budgets something like, I think I'm right in saying about £500 million each, roughly. Lots and lots of staff they've got, but both of them chaired by merchant venturers. I found this quite extraordinary when I first discovered it, that we've got the people from the city elite basically in charge of both of these projects. We've got Peter Rylett at North Bristol Trust and John Savage, who stood to be the Labour Party candidate for Police and Crime Commissioner, both merchant venturers, both chairing Our NHS Trust. So it's like the city elite are in charge. And actually, John Savage, of course, has very strong links to Business West, so the business community seems to be running things.
Well, you're absolutely right, and I think it's really important to realise that, that those two trusts you're talking about are businesses. What has happened is these are and this pressure on hospitals to become foundation trusts. Now, I don't need to go into the full details of this because it's rather complicated, but essentially one way the NHS has been broken up, and it has been broken up, and I think Martin talked about the implications for planning, is that individual hospitals now are being pressurised to become businesses in their own right. And therefore, in order to run a business, you get somebody in as chair or chief executive who's got a business background. Now, I mean, there's nothing wrong in that. In practice, if you're going to run a business, get somebody in who's perhaps got a track record, a good track record. But we need to ask then, what are the vested interests of people who are running these businesses? Staffordshire is an interesting one because Cameron mentioned that. One of the problems with Staffordshire, the hospital there, was it was under enormous pressure to go for foundation trust status, and therefore they had to meet a load of targets in order to justify that status. And in the course of that, care was reduced, and there was some shocking examples of patients being uncared for. So I think we have to put this again in the context of an overall agenda, which is splitting up, fragmenting the NHS and hospitals as well.
Okay. Also, Mike, what can we do about it? This is the problem. It's one thing analysing it, but what can be done to actually keep the health service in this country functioning as it has done so well, and keeping people living so long and doing so well for the last 70 years?
Well, I think, Tony, programmes like this, and I don't know what your listening numbers are, but programmes like this are enormously important to get the debate started within the public. We've just started some artwork in the Bear Pit in Bristol, which is making some statements about the NHS. One of them being, is if we can bail out the banks, we can afford the NHS. And those are that's a very key question that needs to be answered. If we want an NHS, how are we going to pay for it? And we can pay for it. The other statement on one of those billboards in the Bear Pit is that the NHS will last as long as the folk have the faith to fight for it. And I think everybody, whether you're young or old, and young people listening to this might say, well, this is not a problem to me. I don't need to go to see my GP. I don't need to go to hospital. But everybody will be using the NHS one day. And unless we... And
of course, their loved ones will too. Yeah,
we've got to fight for it, and we've got to say we'll pay for it as well.
Yeah, well, let's pick up on the running the economy thing. The idea that by privatising the NHS we're going to make the economy run better is patently wrong. And the deficit, in fact, is going up. So it's funny that David Cameron should mention the deficit, because it's going up. And, of course, they are prepared to spend more money on the NHS once their chums are in charge of supplying things for it, like Capita and Serco and so forth. So but this is a political game where we run it down until we can privatise it. And then, of course, we'll increase spending on it because we're going to get that money. And as you pointed out, the 16 billion that they've added, that's actually gone to their chums in the private sector. And this is all part of a long-run game by big capital in the US and Britain to get rid of the idea of public services altogether.
Well, onto the story I mentioned at the top of the hour. Doctors have expressed dismay at reports that an international arms firm is considering a bid for £1 billion worth of NHS contract to run GP support services in England. American defence giant Lockheed Martin was one of a number of private companies represented at a recent meeting hosted by NHS England for those interested in taking over the contract, which largely involves administrative functions. G4S, whose handling of security at the London 2012 Olympics drew widespread criticism, also attended the meeting, as did KPMG and the US law firm DLA Piper. No potential NHS bidders attended, according to the Health Service Journal. The contract, which is likely to be awarded early next year, is one of the biggest ever put out to tender by the NHS. Mike Campbell, I wonder what you think about the idea of US military-industrial complex running our GP service. And what's the problem if they can do it cheaper?
What amazes me about a story like this is that somebody is disingenuous enough to actually publicise the fact that a major arms dealer is interested in running aspects of the NHS. I don't know where to kind of start on this. I'm horrified at one level that Sir Richard Branson, who runs his Virgin trains across various networks, is interested in running the NHS. But I'm not surprised, because there is obviously a profit there that he sees as worth making. What horrifies me, however, is that we should be seeing a public service being placed in the hands of arms dealers. And actually, ironically, it may be that is a touchstone which makes people think we're going too far.
Well, a Lockheed Martin UK spokesperson who wanted to remain anonymous said our UK workforce already delivers IT systems which protect and enhance our national industry, critical infrastructure and justice systems. I didn't know they were running justice systems. Anyway, and it also enables NATS, National Air Transport System, to navigate more than 2 million commercial flights safely across UK skies every year, and also to ensure that Royal Mail can reliably deliver more than 50 million items to our homes and offices each day. We continue to explore further opportunities in the public sector.
Well, isn't it interesting? Lockheed Martin's reputation in the United States is for cost-plus contracts when they're delivering things like aircraft carriers and bombers and what have you. And of course, that is the model. So the taxpayer pays for everything. So this isn't a free market. But the taxpayer is underpinning all of this. It isn't a market solution, a market situation at all. But they then have private companies supplying the bombers, whatever. I mean, there's a strong case for the nationalisation of arms industries for exactly that reason. But of course, what happens is once you've got your foot in the door, there is no competition. You become the supplier, just as First Bus has become the supplier of transport in Bristol. There is no real competition. And of course, that's the game. And of course, that's using the state's power to underpin private profit.
OK, Mike Campbell from Protect Our NHS. Whereabouts can we find you on the internet? And also, do you actually meet physically, come together?
Yes, we meet the first and third Tuesdays of every month up at the Robin Hood pub on St Michael's Hill. We're running a stall on Wednesdays, Fridays and Saturdays at the Bear Pit. We're inviting artists, performers to come along and contribute to our, what we're calling Love Our NHS month. And we have a blog that people can find, www.protectournhs.wordpress.com.
Well, Mike Campbell from Protect Our NHS in Bristol, thanks very much for joining us on The Politics Show.
Welcome.
Getting bigger by being better. The #1 choice for Bristol. This is BCFM 93.2.